Hello, and welcome to Estafet, where we interview Earth members and get them introduced to the community. Last time, we were in Romania to meet Victor, and Victor recommended Alexandra Stefanescu. So we are here in Romania. Dear Alexandra, a hearty and warm welcome to Estafet, and I hope I pronounced your name correctly.
Thank you, Shalini. It's Stefanescu, but it's okay. I'm used to my name being pronounced incorrectly, working internationally. So I just go with Alexandra because that's short. Thank you for the welcome and nice to see you again.
Same here. And last time when Victor introduced you, he mentioned that you're hiding your glow. So today, I want you to glow completely. Don't hide. Share and talk whatever you want from your heart. And let's get started. Could you please introduce yourself, your name, where you're from, where do you live, what education training do you have, especially regression therapy and others?
Okay, sure. So, of course, I'm in Bucharest, Romania. I'm a regression therapy. I'm the only one in Romania that have finished TASO International. So that was my study in regression therapy. But before that, I did had 2 years with a former student of Victor of regression training as well. I'm certified coach. I do neuro coaching and I do systemic coaching as well. But this is something that I started when I was 19 in my 20s. And then my career started with something else because I was passionate about writing. I wanted to journalist. And that's how I started getting into marketing and digital marketing. For 16 years, I've been an international digital marketing strategist and sales trainer. So this was my way of making sure that I give something to my very analytical mind, but also something to my soul. So personal development and coaching was always on the side as a side business, and was something that started to grow. And I just started that completely just 2 years ago. So yeah, but I've always managed teams. I've always worked internationally, and I had the chance to travel almost all of the work. I still have to see Asia for work. And I do have to say that everywhere in this world, all our problems are the same. When it comes to the soul, there's no difference. Every culture, every type of race, everything that you can imagine, we're the same and we're connected.
And you're right, and what all activities in the regression field you do to, or suggest to deal with these problems?
So personally, I have been specializing in 2 types of problems, mostly 3, because, you do tend to have some kind of clients that come to you. So I've been specializing in working with cancer patients under the supervision of Martin Roche, and I'm very lucky to have him as my mentor. And this is something that isn't done in Romania. I'm just starting this out. Hopefully, we're also going to have a new book coming from authored by me and Martin this year. And I hope there's going to be many more like me, because there is a lot of work to do. When it comes to cancer, it's the most important thing to do is to see it as a message, and to keep that space and that willing to show that person that it is not something just happened out of the blue. It's not something that happened to him. It's something that happened for him or for her. So every time I work with a cancer patient, I always try to make sure that I'm leading them to see the message that the cancer is trying to tell. Because at a cellular level, the cancer is just simply, I'm so desperate to tell you my message, and I'm so desperate for you to hear me, that this is the way I'm dealing with this. And it's a part of us that just wants to be seen and just wants to be heard, and doing it out of desperation. So when it comes to working regression therapy, I have 3 fine tunings that I'm doing. despite of my my TASO training. I've applied a systemic coaching to it because I need to make sure that whenever I'm getting to know someone, I'm getting to know his brain states. Because if I have someone that's going to be, most of the cancer patients, they go through radiation, they go to chemotherapy, their nervous system, they're in hyperarousal. They're usually depressed, they're usually not ready to work, lengthy hours of regression therapy for 4 hours. They can't sustain that. There's no energy for that. So that's why we do first the energy work. That's why we do first the rehabilitation of the nervous system, and we work with the vagus nerve. And I can demonstrate that because that's something that easily anyone can do in the office. And I even train my patients how to do certain things that are somatic for them to be able to cope with the pain and the after effects of chemo. Because that's something also that needs to be addressed. And of course, then you work on the relationships because you want people to be able to receive the protection from others, to receive the help. And most of the times, there's a lot of shame and there's a lot of fear that's involved when it comes to cancer. So you have to clean that first because those are going to be the blockers in your therapy. And only then you do the regression work because there's no way out otherwise. And most of the time, I speak to that part of them, the self part, that is usually the one that you can actually gain access to and can guide you. So for me, doing this kind of work, I'm honored, even if it's about healing someone and making sure that you guide them towards healing, or just accepting that the end is near and making sure that the passage for them is much easier. And for me, being also, I was diagnosed with cancer. It was just a scare back then. So doing this kind of work and knowing how everything in my life started to be, it's just, completion of all my ordeals and all the things I've went through. I went through an NDE, a near-death experience, a lung tumor. And that was also the time I decided I don't want to be a corporate, I don't want to be a CMO. That was my dream before. I'm just going to do my work, that I came here. And I remember I was in the corner. They were doing a very lengthy operation of taking out my lung. And I was in the corner and seeing my doctors performing the operation, hearing everything, being conscious of everything that was happening. And I had a choice then. I had either the choice to stay or I had the choice to leave and go home. And as much as it's so interesting to go home and the light is so inviting, I was seeing the path that was laid before me, my mission and my soul wants. And that's how everything folded out. It went just naturally to do the regression training, to start working with cancer patients and everything. So yeah, it is my life mission.
Amazing. And I wish you all the best.
Thank you. And of course, I do get the NDEs people as clients because after you go through such experience, there's everything seems very doesn't make sense anymore here. When you go into that light and there's no duality, there is so much freedom, there's so much joy and love, and you come back in the here and now, you get into a depression and you get the lack of sense because you have to reconstruct yourself and you have to make sure that whatever you're doing is, going towards that light. So yes, those are also my kind of people that I work with.
So how your near-death experience have been, or say how this experience has affected you as a person or transformed you, evolved you as a person?
So for me, I think it was a wake-up call. And I say this dearly. I'm a channeler by birth. I was trying to hide that. I was trying to not be a psychic, not hear the messages, not go on that path. And this was my wake-up call because I was just stopping that for years and years. And it took a toll on my mind and it took a toll on my health. So accepting also my shadow parts and things that I wanted to keep clear from me, I think that was liberating, and it changed my sense of self, the way I see the world. It toned down my savior, that's for sure. And there's so much joy. Even there, it made me realize that even in really big difficulties and, you know, working with cancer and everything, there's a sacredness, and there's also a thing of the light still has to be there. Without, you know, without darkness, there's no light. And I always have this connection and this feeling that we're never alone. And it's always more to see and always more to experience. And it's just lovely. You always feel guided, and you always feel that you can trust the universe, which is a
When
very
you're,
simple way to live and very, very fun.
I'm having goosebumps when I'm listening to you. Alexandra, would you like to share some of the stories working with these patients, cancer patients, your experience which have touched them working with you and you working with them?
Sure.
Something you would like to share.
So I can share the case of a patient that is battling with breast cancer. And when it comes to breast cancer and every type of cancer, it really depends where it's located, and you really have to see what's the underlying cause for it. And she's also a mother. She has 2 kids. And what I always do, and I always work with cancer patients, I always work prenatal, conception, and birth. And I'll explain why. First of all, most of the time when you have, during prenatal, and we find out for this woman, her mother didn't wanted her. She wanted to be to do an abortion. So that was the first split in her energy. That was the first decision when I don't deserve to live. So it's the first, because cancer by default is an auto-destruct message to my system. So that was the first one, the very first time it happened. So we don't go into past life. We always deal with the present because we need the person to have resources now. And when you go to the prenatal and you look for that auto-destruct program and the self-damage that starts to happen, and you connect that to the present moment, people just start looking at their life differently. And there's this certain amount of energy that gets reset when you do the rebirth, when you have a normal birth, when you have a great experience, and you have the client welcoming that child, instantly the program at I don't deserve to live just got erased. And I can tell you enough that her cancer cells started to stop from spreading, it started shrinking, and that was just one session.
That's wonderful.
And when you connect that with what I want to give to my children and what they want to see and how I want them to see me battling this and making that the motivation and giving that hope, because you always have to work with hope. That's going to be your best resource all the time. It starts to grow. And when you have the mind connection, you allow when you have the mind connection, and basically you allow also a brain state in which she is connected, and her hippocampus is going to encode good memories and hope and everything, you're going to erase the trauma. Because what happens when you're in a trauma, your hippocampus is basically a programming encoding, and it gets a snapshot very, very clear with all the details. And after the trauma, there's nothing, there's no encoding. So I usually work with the brain states in regression therapy because I'm trying to trick the mind to make sure that they're really encoding in their hippocampus and in their amygdala, the safety, the resources, and integrating those at a cellular level. So when it comes to cancers, this particular patient has started having a different relationship with her kids. She's now a lovable wife. And I don't stop there because I'm working with cancer, okay? I need to make sure that the body is okay as well. Because when you work with cancer, you start working physiological. So you need psychosomatics, you need somatic work as well, and you need help for the body. So what I usually do, I collaborate with a homeopath doctor. And I also collaborate very, very dearly with Vasile Ardelanu. He's a doctor. He's a former student of Victor. So he understands regression work and is a great acupuncture. He's using the Yamamoto technique, which means that on the scalp, you have all of the points of the body. And even in the sternum, basically, if you see my sternum, this will be my hands. And underneath is going to be my lower body and my legs. So there's very, very small points, just a few ones, and the effect is instantly because they need support. So it's basically working on many layers in making sure that the person is getting support, not only for their soul and their mind and their emotional turmoil, but also physically. So yeah.
Amazing. And Victor has mentioned about that you're working with cancer patients, and he's also mentioned that, like, that's what his question. And he also mentioned you also work with birth and prenatal because our present life has been affected by it. So, like you mentioned about the cancer patient, do you have any other example or any other stories or references where you feel that birth and prenatal is so important for us to know, which affects the present life?
Yes. So usually I'm very keen, and I've been doing working with the body. I did osteopathy, and I did Yumeiko, I did massage therapy and everything like that. So for me, it's very easy to work with the body. So I usually get cases that also have body ailments. So for example, I had a patient. She had a brain cyst. And working with her, because also she was on medication, very for pain medication, anti-inflammatory, that's going to make the brain being in a state of numbness. So it's really hard to work with that kind of patients usually. So what I did was work with the part of her, the little child, small part in her, and that part, personalize that one and make sure that she's going through birth and prenatal. And this is how I uncovered the fact that the cyst in her brain, and that was also discovered afterwards, was a twin that she absorbed during the pregnancy. So she always had this feeling of, I'm all alone and I'm missing someone and I don't know, and the lack of sense. So when I heard that, I said, okay, that's a vanishing twin. So that was just one session, and the brain started to be becoming less and less inflamed, so she could do the surgery to extract it. So I always look for what are the body programs that were instilled in prenatal, because that's mostly when we start developing our body. That's also when the problems start to be encoded. And we know that it's demonstrated to epigenetics. So I'm just going on the path to see the problem that I have now in with my body. What is the treatment that is not working? What are the things? What are the causes? The emotional, but what happened also during the prenatal that made this problem to be, so severe now. And I also look for people that are unwanted child, people that have been birthed through a C-section. When I'm working with depression and when I'm working with people that have a lack of motivation, they usually have ADHD, and they have a problem with there is a trifecta. Basically, you have the brain like this, okay? You're going to have the amygdala in here, and this is your limbic brain. Most of the person that have been born through a C-section, they have one issue. their amygdala is always going to be on high alert and affected, and their limping brain is not really connected to the cortex very well. They're always going to have having some difficulties. And basically, I do the work and I work on the bird because that sense of lack of motivation, ADHD, everything start decreasing afterwards because they reclaim that energy. When you're not having a natural birth, you don't have that sense of I have to fight. I have to take that fresh breath of air, and I have to go through that birthing canal, and I have to do that lineage of getting my soul into my body. So when you work with a bird, everything starts normal, and you can replace that energy, and they can reclaim it, and their life starts to be better.
And that's such an important information for the mothers to
Exactly.
be that what is the difference and how the difference, I mean, as a choice, C-section and natural birth, C-section sometimes comes easy, but it could have such a big impact on the soul which is coming. That's
Yeah.
a very
And not
important.
just on the soul, they've demonstrated now, I've just read a study that when the mother has prenatal stress, basically the brain development is always going to be affected. So that means that my brain states are going to be in lack of, I'm going to have that lack of control. So instead of having a certain view of life that I'm in control of my life, life is something that I do for me and I make it happen, I'm going to see you're the point, you're the one that is your fault, and I'm going to become a victim and I'm going to externalize all my power. So it's way more than that, unfortunately. It affects the gamma receptors in the brain and all the chemicals that help us feel worthy and happy. So yes, it goes more than that.
Do you conduct workshop also for awareness of these things about cancer patients, about prenatal and birth?
I'm planning to do a workshop for that. The first one I think is going to be for mothers that have been dealing with thrombophilia, which is one of the main reasons for having abortions and having miscarriages. And then the main reason for having a FIV, because that's also something that I work with people that are trying to conceive. And yes, awareness needs to be done.
Look forward to that. Alexandra, you also mentioned that cancer cells are there to tell us a message. So when you work with cancer patients as well as patients or clients with other problems or issues in life, how do you connect with the message? Do the cancer cells in different parts of body gives the same message or a different message? Or does it have a, like if cancer cell is like breast cancer will give a similar message, or some other cancer will, throat cancer will give a different message?
Okay, so first of all, let's think about parts of us, okay? Because we're not a mono part human being. We have many parts. So when I have a part of me that wants to self-destruct, the reason for that is always going to be my reason. It's always going to be personal for me. So the message that a cancer cell has for me always has to do with my life, my way of coping with the things that have been going on in my life. So there are some similarities, like breast cancers. There's always going to be a program of I'm not good enough and a sense of self-esteem that's very low, but not necessarily. So there's no message that's always going to be the same, okay? It always has to do with my lack of connection with myself and the things that I'm trying to hide from myself and I don't want to look at them. It's always personal. By the way, the message is always one of love, which in a way, it's kind of funny because something that tries to kill me, it's also trying to dearly love me.
It's connecting me to that part which I'm not looking in a way.
Yes, and it's in a such a compassionate way, in such a way that you cannot feel anything than love and compassion towards that part.
Mm. I've never seen in my life talking about cancer so beautifully and
Well,
with so positive message. Really, really wonderful, Alexandra, and wish you all the best. And may you spread this work and conduct more and more workshops. I would not like to say that we are coming to the end of the interview, but since we are, so I need to ask you, what is the message you have for therapists, and what is the message you have for Earth Association or regression
I do
therapists?
have one message first for my TOS alumni, which is please practice. We need more of you.
Mm,
So start gaining that trust in yourself and start showing your work and start promoting your work, please. And for art therapists, I'm so grateful to be a part of this family. And that's gonna be my cat. Sorry. 1 second. I have to take her, otherwise it's gonna be
yes,
okay.
you can say hello to her. Maybe she has answers. She's a smart one.
Yeah, she's a therapeutic cat as well. Okay. So my message is to birth therapists and all regression therapists is please make sure that you do your work more and more and make it more visible, because there are so many other types of modalities and working that are just scratching the surface, and the world needs us more and more now.
So true. And Alexandra, anything you would like to say for Earth Association?
Please be on TikTok and be more active, because you can have the chance to be viral. And an easy way to do that is just make a contest. Just ask for recordings and clippings from the people that are certified with Earth, and you're just going to get content all the way. It's as easy as that.
And as the tradition goes, you go to announce who will be the next person to be interviewed. And what would you like to ask?
I couldn't make my mind, because I would have to choose between two of my dearest people in the world and mentors. So I chose both of them. So the next Estafet, we're going to Germany, and we're going to talk to Martin Roche about his contribution in working with cancer patients, because he's also my mentor, and I know that his work is really, really needed. And of course, because all of us at one point of time, we heard about the fairy godmother of inner child work, which is Trisha Caetano. And I think that working with our inner child, more than just going to a past life, is the most important part of the therapy. You have to have a stable inner child and a stable state of mind and a stable brain state in order to do the regression work. So my next one is going to be to Trisha, and I would like to her to talk about what made her invent the all the inner child work, and after 40 years of working, what is her message for us, because we always want to hear more from her.
Hmm. So what do we do? Who is the next, Martin and Trisha? Because both are wonderful.
We can take both. I think it's wonderful.
Thank
Thank
you
you.
so much for your time, Alexandra. It was lovely talking to you. And I think it's not enough. We'd like to hear more and more from you, maybe sooner, maybe in the
Soon, soon,
convention,
soon.
and maybe in the workshops. And all the best.
Thank you, Shalini. Thank you.
Thank you so much. And all the viewers, I hope you enjoyed too. I enjoyed every bit of it. I know you must be this interview, though it was not short, but it sounded so short that I wanted to hear more and more. And looking forward to hear from Martin and Trisha both next. Thank you so much.